Bed sores can be fairly common in elderly people, especially those who have mobility problems. As people age, the skin generally grows thinner, leading to the potential for greater injury. That means elderly people who suffer from diseases or injuries that limit their mobility or who don't receive an appropriate amount of care are the most likely to develop bed sores. These painful sores develop when a person remains in the same position for an extended period of time. Bed sores are normally found on bony areas of the body, such as the tailbone, buttocks, lower back, hips, ankles, or heels. They can be extremely painful and may lead to other more serious conditions. There are 4 stages of bed sores with varying degrees of complexity and medical risk. A stage 1 bed sore may have the appearance of a bruise or a red spot at a bony point of the body, and the elderly person may experience a sensation of itching, pain, tingling skin, or numbness. Bed sores advance to stage 2 if they're allowed to progress. At this point, an open wound will develop at the site of the original bruise or red spot. Stage 3 bed sores are far more serious and involve deep ulceration of the skin. They may also grow in size and can potentially expose tendons, muscles, and bones. Stage 4 bed sores may lead to life-threatening complications and infections such as sepsis. The skin may be seriously damaged, along with a bone infection and lack of skin sensation. There are 5 main causes of bed sores in nursing home and long-term care residents. Pressure is one of the most common causes of bed sores. Bed sores can develop when there's a constant weight on one part of the body, and this pressure leads to reduced blood flow to the tissues. When that happens, nutrients are restricted from passing through to areas in the body that need them. This can lead to skin and tissue death in the affected areas. Commonly affected areas are the spine, shoulder blades, hips, heels, and elbows, which are all locations that don't have a lot of muscle and fat lying over the bone. Friction is another major cause of bed sores. If the skin frequently rubs against clothing or bedding, it becomes vulnerable to injury. This is particularly true when the elderly person lies in bed but moves certain body parts frequently, such as the elbows or heels. If the elderly person is often subjected to movement in the opposite direction, they may develop a sore. This is called shear. Common examples include a person being elevated in a bed but sliding downwards due to the angle. As the tailbone moves down, the skin over the bone may stay in place, which pulls it in the opposite direction. Moisture can also be a problem, especially if an elderly person suffers from incontinence. If the patient is unable to maintain control of their bladder or stool, they may develop moisture in that area, which can severely irritate the skin. Malnutrition occurs if elderly people don't receive necessary fluids, calories, protein, vitamins, and minerals in their daily diet. When not enough nutrients are available, it can result in less healthy skin and bone, and make the person more susceptible to bed sores. Unfortunately, bed sores can be the result of nursing home neglect. Caregivers and nurses who don't make sure that patients receive appropriate care, especially when they're at risk for bed sores, may be committing abuse through their neglectful inaction. Family members of nursing home residents should pay close attention to the health of their loved ones. If you are suspicious that an elderly loved one is being harmed, you should keep notes as documentation and take photos of any evidence of abuse. Talk to doctors and staff to let them know about your concerns. If action isn't taken to your satisfaction, you might need to seek help. Fortunately, bed sores are preventable in most cases. Caregivers have to take an active role to make sure they don't develop, especially in cases where an elderly individual has extremely limited mobility. Nursing home caregivers can reposition the patient regularly to avoid pressure on one area of the skin, keep the skin clean and dry, make sure they eat well and drink plenty of water, help manage their stress, make sure the elderly person exercises daily. You can safeguard their welfare and help prevent bed sores from developing. The more involved you are with your loved one at the nursing home, the better their chances are for a higher quality of life and care. There are laws to protect the elderly from neglect as residents of nursing homes or assisted living facilities. If you believe a family member suffers from bed sores at a nursing home facility or was injured in a nursing home due to elder abuse, maltreatment, or neglect, contact us for a free case evaluation. We can help determine if you're eligible for compensation for medical costs resulting from bed sores caused by neglect. Our team of legal experts is happy to hear your concerns. nursinghomeabuse.org, exposing nursing home abuse and helping seniors get justice.